NACDL is the association of the nation's criminal defense bar.
Hello and welcome to all of you. As Monica was referencing, I am the Senior Communications Director at NACDL. As part of my portfolio, not related to communications work though, I have for several years served as NACDL's designated policy person when it comes to HIV and other infectious disease criminal laws. I serve as NACDL's primary representative to the Positive Justice Project, which is an initiative of the Center for HIV Law and Policy, which you will hear from in a moment from its founder and executive director, Catherine Hansens. And I also serve as NACDL's representative to the National LGBTQ Criminal Justice Working Group. Today's topic is criminalization of sex and status, HIV, gender identity, and race. The legislative history and enforcement of HIV and other infectious disease criminal laws reveals several consistent factors at its root: homophobia, transphobia, class, and race bias, as well as a profound lack of literacy when it comes to the routes, risks, and prevention treatment realities of infectious diseases. Our panel this afternoon is going to examine continued criminalization of HIV and other health status, the undermining of the central principle that criminal intent is required, should be required for criminal liability, and efforts to reform these discriminatory laws. The panel is also going to explore the relentless efforts to use the criminal law to punish and marginalize transgender individuals. I want to first introduce Catherine Hansens. I have had the honor of working with Catherine for many, many years. NACDL has had the honor of working with Catherine in the Center for HIV Law and Policy for many years on everything from continuing legal education programs for attorneys to Catherine's invaluable assistance more than 5 years ago, helping NACDL put together a terrific policy statement on HIV criminalization that was adopted by NACDL's Board of Directors unanimously back in May of 2016. Catherine is the founding executive director of the Center for HIV Law and Policy, also known as CHLP. It's a national legal resource and support hub that challenges barriers to the sexual health and rights of people on the basis of stigmatized health status or identity. CHLP's legal advocacy, high impact policy initiatives, and creation of cross-issue partnerships, as the one with NACDL, networks and resources all amplify the power of communities to mobilize for change that is rooted in racial, gender, and economic justice. CHLP coordinates the Positive Justice Project, the first national network to challenge criminalization of HIV and other diseases, and to launch the decriminalization movement in the United States. Catherine's been working on HIV legal and policy issues since 1984 through litigation, legislative lawyering, community organizing, and policy advocacy. Prior to the creation of the Center for HIV Law and Policy, Catherine was a clinical professor and director of the Women and AIDS Clinic at Rutgers University Law School, director of Lambda Legal's HIV project, and an attorney with the New Jersey Public Defender, where she successfully litigated the first cases on involuntary HIV testing and incarcerated women's right to both decent prenatal care and to have an elective abortion, and a class action challenge to segregation and mistreatment of prisoners with HIV. Catherine also created and managed one of the first medical legal partnerships in the country with on-site HIV legal services in hospitals across Philadelphia. Also on our panel today, and we are oh so grateful to Eric Pauk and to Georgia Equality, is Eric Pauk. Eric Pauk is a lawyer and an advocate working on issues impacting LGBTQ communities and communities of people living with and vulnerable to HIV acquisition. He serves as Deputy Director of Georgia Equality, where he oversees all day-to-day operations, developing and managing local, state, and federal policy and advocacy activities that advance equity and fairness for LGBT communities and improves public and private responses to the HIV epidemic. Prior to joining Georgia Equality, Eric served as the Tyrone Garner Fellow at Lambda Legal, the oldest and largest organization dedicated to advancing the civil rights of lesbians, gay men, bisexual, transgender people, and individuals living with HIV. At Lambda Legal, Eric's work focused on HIV law and policy initiatives with an emphasis on legal issues disproportionately impacting Black LGBTQ communities. Eric has spoken at leading law schools and national advocacy conferences on HIV criminal justice reform, the impact of school to prison pipeline on Black queer youth, and the intersections of race, poverty, HIV, and LGBTQ issues. He serves on the board of the Atlanta Harm Reduction Coalition, the Equity Federation, and the Pro-Georgia Civic Engagement Table. a nonprofit coalition of more than 30 voter engagement groups throughout the state of Georgia, working to ensure access to the vote for historically marginalized communities. Eric is former New Leadership Council Fellow and former Victory Institute Victory Empowerment Fellow. Most recently, Eric was named as one of the 100 most influential LGBTQ+ Georgians by the Out Georgia Business Alliance and is one of the state's top 40 leaders under 40 by Georgia Trend magazine. Eric is a graduate of Morehouse College and received his law degree from Pace University. He's currently serving an 18-month term as a Soros Justice Fellow, where he's focused on creating a network of Black HIV lawyers to support and advocate for communities of people living with HIV. Now, I'm going to open this discussion by pointing out that even with a couple of recent advances, about 2/3 of the states in the United States of America criminalize HIV. And, you know, I don't think we could have anyone better to talk to us about why we have those laws and how to get rid of those laws than the folks that we have on this panel today. And so I turn to you, Catherine, and ask, could you please tell our audience about the origins and purpose of criminal disease exposure laws? Where did they come from? Why do we have them?
Well, first, did everybody get all that? I'm really honored to be part of this panel, and thanks so much, Ivan, for inviting me to participate. I think it's useful in answering that question. Of course, I can't just give you a plain, straight sentence answer. It's useful to think about the history of public health surveillance of disease, because I think there's a very close relationship. Folks may not realize that it was really only until the latter part of the 20th century when the names of people with certain stigmatized diseases like syphilis and gonorrhea were not published in the newspaper. I mean, we were actually publishing the names of people in the newspaper until the latter part of the 20th century. And the primary purpose for names reporting and surveillance was really to allow direct intervention with individuals. And when private physicians balked at this kind of interference with their practices, they were assured, and this was part of the law surrounding surveillance, that they could opt their patients out. So that as a consequence, upper class patients and middle class patients who had access to private physicians were protected from supervision, and really reflecting the broad assumption that there are some classes of people who are more of a health threat to the rest of the public than others. There are, and this, in the same way, criminalization of disease really does go back to the turn of the last century, in the early 1900s. I think, there are certain recurring themes in how diseases are identified for criminalization, and certain kinds of themes of reactions. And some of this goes back to the bubonic plague in the Middle Ages. The first is, what is the larger public's understanding of the disease and how it's transmitted? How is it reported and explained, whether it's a sheet nailed up on the local square or whether it's the press? And to what extent, as a consequence of that, are unpopular or marginalized communities blamed and punished for an epidemic? I think that there always have been the same stigmatizing assumptions around class and race that are reflected in the nature and enforcement of STI laws and anti-prostitution laws, which again harken back to the turn of the last century. And a lot of the policing of sex workers was really to protect the general public from disease. So, and again, it's not, in fact, Ivan and I were talking about this the other day. One assumes that there are conservatives that lead the charge on these things and progressives that think they're a horrible idea. But in fact, in terms of anti-prostitution laws, those were really led by progressive women reformers who thought, in the effort to save women, that these extraordinary intrusions into their bodily autonomy was permitted. Women were arrested on the basis, if they were sex workers, on the basis of the assumption that they had infectious disease, they were inspected, they were locked up, they were subjected to incredible forms of brutal forms of treatment without consent or any form of due process. So that's the history. That's part of the history, more the themes than a lot of the details.
Yeah, I mean, Ivan, I just, piggyback just a little bit on what Catherine has laid out for us. But, really just sort of, when we think about just sort of HIV criminal laws, specifically, and thinking about, 1986 sort of being the year that I think that we saw like the first HIV criminal laws come into place. And I think it's also like, I think that we also have to think about that in context of like all the other things that are happening around 1986, right? So, we have this, crack has hit most major cities, by 1986. There's this, ramp up of the war on drugs. 1986, October of 1986 is when the MMR, released data that minority communities were disproportionately being impacted by AIDS. And so you have all these sort of things that are happening to really kind of create this perfect, storm. 1988 is when President Reagan created a commission around HIV and AIDS, and they released a report in 1988, really around this notion of criminalizing HIV positive status. 1990, you have the Ryan White Care Act, which ties federal funding to states having some way to punish folks for potentially intentionally transmitting HIV. And while states weren't required to create anything that was specific, states created things that were specific. The general law could easily, facilitate punishing folks who were seeking to intentionally transmit HIV to folks. And so you have all these really sort of dynamic things happening, at one time, when we think about the way that Black women were policed around having quote unquote crack babies and really this sort of, notion about policing, the wombs of Black women. And so all these things are just, really interestingly interrelated and all sort of happening at one time. And I think it's important for us to put this conversation in context of all those other things that are also happening and converging in that moment.
Let me jump in there because when you talk about someone who would be intentionally seeking to infect somebody else with HIV, that's probably a very small subset of the people who would be captured by the kinds of laws that exist in about 2/3 of the states now, which have to do with disclosure, even in the context where somebody's not capable of transmitting the virus. Maybe you could talk a little bit, Eric, about the features of these laws that are in place today. Who is vulnerable to them? Maybe talk a little bit about Georgia, and Catherine, you can join in and talk to us about what are the elements of these laws and who's exposed and why.
Yeah, I mean, when I think about sort of the elements of these laws, and they are and can be very different across the country, right? But when I think about some of the elements that are consistent, one is the lack of intent, the lack of a mens rea that's missing, in most of these laws. The fact that, the punishment is disproportionate to, to the act. So, in Georgia, it's a felony punishable up to 10 years. It doesn't require transmission. It only requires, exposure. It avoids any of the new science that exists around, actual modes of transmission and likelihood of transmission. So in Georgia, spit, urine, feces are elements of the statute here. We know that those are not ways that you can transmit HIV, but they are, codified into the law here. And so, I think those are the three real elements, that really end up impacting marginalized folks who often don't have good access, to the resources that they need to defend themselves. And so really thinking about how we modernize these laws so that there is some, element of intent that, actual transmission is actually required here. And that if, someone is going to be if someone's going to be punished, it certainly should not be a felony up to 10 years in prison, when there's been zero transmission.
Well, and I think I'm going back to one of the several themes that I mentioned before, which is these several elements that are common to the reactions of the public and the government to scary infectious disease. When you ask about intentional transmission, the one case that pops into mind, which is frankly the only case I'm aware of where there was actual proof of intent, was when a man took a vial of HIV blood from someone who was HIV positive and injected it into his infant son in the hopes that he would not have to pay child support. I mean, it's an incredibly bizarre, sad case. But again, the riskiest kind of contact that one can have in terms of the risk of HIV transmission is if you are the receptive partner in anal sex. And even if you don't factor in treatment, even if you don't factor in a variety of other issues, the risk of transmission is about, maybe 2 or 3 per 100. If the person is on effective treatment, it's 0. And this is the riskiest. So if you intend to harm somebody, there are a hell of a lot of other more efficient ways to go about it than to attempt to infect somebody when you have maybe a 2 in 100 chance of doing that. And when the person with current treatments is going to probably live to a ripe old age anyway. I mean, HIV, the other thing that's unique about HIV, again, it was not the first disease that was criminalized. There are many states, if not most states, have some form of punishment for disease exposure, STI exposure in the public health code or the criminal law. But what is unique is that with few exceptions, they treat the exposure to HIV, and exposure again has no bearing to what actual exposure means in terms of how HIV is transmitted. That all of their felonies, they're generally felonies. In 8 states, viral hepatitis exposure is also a felony offense. So it's not just HIV. And one of the things that's interesting about that, and again, how we stigmatize certain populations, there are other incurable sexually transmitted viruses such as HPV, which depending on the strain causes far more immediate and serious harm. HPV is the cause of pretty much all cervical, vaginal, or anal cancers, far more deadly than HIV, far more likely to kill you. long before you reach old age. But again, HPV is extremely common in the population, in the hetero population, and most adults, if they're lucky enough to be sexually active, are likely going to be exposed or have HPV at some point. The same is true of herpes. It really, HIV has been like tuberculosis when people were, arrested and held. It's associated with more marginalized members of our communities, gay men, Black men, people who use drugs. And thanks to the Williams Institute with UCLA that did a real deep dive into several states to see actually who was being arrested, who was being prosecuted and convicted. We learned that in Florida and Georgia and California, between 70% and 95% of those who are convicted and serving felony sentences are women who are sex workers. In Missouri, the overwhelming majority of those who are convicted and serving felony sentences are Black men who find themselves in an altercation with law enforcement or corrections officials. So it is really, in fact, and I suppose for many of the people on this webinar, anybody that's involved in criminal law reform or criminal defense, it's not all that shocking because the distribution of cases is very similar in many ways to the way the rest of the criminal law is enforced.
So before I turn to my next question, I invite you both to correct me if I'm wrong, but it strikes me that current medical science has taught us a few things. The sooner one finds out that one is HIV positive, the better off one is, and the more effective treatment is going to be, not just in ensuring a full and complete life and life expectancy, but also in decreasing the viral load to the level at which it is undetectable, and therefore making it virtually, if not completely impossible to transmit the virus through sexual activity. That's all correct, right?
Mm-hmm.
Yes.
So then the smart thing to do, because we're in the midst of a 1.5 year long conversation in this country about the basics of public health. The smart thing to do is to encourage people to get tested and to get treatment if in fact they test positive. These laws, though, they strike me as being, wrong on other levels too, because they create a perverse incentive, don't they, to not getting tested. Because if someone is positive, but they don't know that they're positive, then their exposure to prosecution under these laws isn't the same as if they conducted themselves the same way, but knew that they were positive. Is that right?
Yes. I think, people are going to have sex regardless of the perceived consequences. There isn't any data to really show a strong connection between a state criminal law and testing rates. But then again, most people don't know about these laws until they find themselves in the crosshairs or are asked to defend someone. And, I think we've all had the experience of describing these laws and the prosecutions and the kind of time people are serving for spitting on someone to, colleagues and, whether they're lawyers or not, who are stunned to hear this. And but it's the same, for people who are familiar with the HIV epidemic and the COVID epidemic. There again are similarities, a glacially slow response of the federal government and state governments to take the epidemic seriously, respond to it seriously, and then of course an impulse to look for and blame a despised other, whether it's China or Chinese Americans in this country, and then we've seen this as well, a reflexive reach for the criminal law and police powers and to respond to this, to protect the general public from people who are intentionally spreading the disease. I mean, same thing over and over. It's not, it's a, we just have a perennially unsound, public health-wise unsound response to scary infectious disease. I mean, it's seems to be a part of our history.
Yeah, I mean, I just add to that, you know, the previous administration, you know, is planning to end HIV by 2030. And you can't end the HIV epidemic without reforming these laws. Like, you just don't get there without, you know, making drastic changes. I mean, these laws, you know, reinforce, you know, stigma. So, I mean, there is a, you know, potential disincentive to get tested. And so we don't meet that goal without reforming these laws. You know, I also want to just like highlight, you know, sort of the, you know, what I call the sort of like Blue Lives Matter parts of, you know, HIV criminal statutes. And so, you know, here in Georgia, it is a penalty enhancement if a person is living with HIV and spits on or throws urine or feces on a correctional officer or any other sort of peace officer. And so, you know, when we think about sort of building a bigger tent, you know, the same sort of tactics and strategies that, you know, exist in, you know, movements around criminal justice reform and sort of racial justice specific spaces are the same tactics that you see, you know, happening, you know, here sort of in the HIV movement space. And, you know, I think the quicker that we understand that, you know, the same folks who are being, you know, criminalized under HIV statutes are the same folks that are being criminalized in all of these other areas as well. And so, you know, I think that's an important part for us to think about. This is just a broader extension of the work that has to happen in sort of the criminal justice movement space.
Now, both of you at different points talk about the issue of intent and the absence of an adequate mens rea requirement in these laws. And just for those in the audience who may not be too familiar with the doctrine of mens rea, but historically, there to be two aspects that turn something into a crime. It's the bad act, the actus reus, and it's the bad intent or the bad mind, the mens rea. It's the difference between charging someone and tackling them to the ground and slipping on a banana and running into them and then falling on the ground. That's as plain as it is, whether or not you intended to tackle the person to the ground. What success have different arguments, whether related to mens rea or other aspects of HIV challenges to HIV or other infectious disease criminalization? What challenges or principles have been successful, if any, in legal challenges to these types of laws? And that's a question for either or both of you.
Well, I think, I mean, HIV and other disease exposure laws are treated the way, there are very few offenses in the criminal law that are strict liability offenses. I mean, in that, you know, or that are status offenses, right? So drunk driving, it doesn't matter whether you intended to harm anybody, but if you're drunk, if you have a certain level of alcohol in your system and you get behind the wheel of a car, you are automatically open to criminal charges. There are charges related to, there are some environmental crimes where intent doesn't necessarily matter, but generally in crimes against the person, which is what exposing someone to HIV or a disease would be, it's extremely rare to have a situation where it's if the elements are if you have a certain status, meaning you're living with the disability of HIV, and you engage in conduct which for everyone else is either legal or a misdemeanor, spitting on someone, then you are guilty. And even for conduct which poses no risk of transmitting. And I think what I have found is the most effective is trying to eradicate the STI and HIV illiteracy, which is profound in this country. I mean, it's possible to pass and uphold these laws with a straight face only if you have absolutely no idea about how HIV is transmitted. And we've been working with the Association of Prosecuting Attorneys now for some years, and have convened a prosecutors roundtable on HIV and other infectious disease laws, and bringing in somebody who is an infectious disease expert who simply goes through the mechanics of HIV, how it's transmitted, how it isn't transmitted, what kind of treatments are available, what you can do in terms of prevention, changes people's minds. I've been in rooms where prosecutors have informed me or informed the group that the information they received, not from an advocate, from an infectious disease expert, has caused them to either dismiss or reduce charges in cases that they were handling, or also to have informal policies of non-prosecuting in a couple of places. So, I mean, I think I hold I really place a lot of the blame at the feet of state and federal public health officials who have remained largely silent, in the face of some of the historical media around some of these cases, and have really in some ways left a vacuum in terms of information and response that law enforcement has filled.
Let me jump in. I have one more, big question on HIV and infectious disease criminalization. A big one. I'm going to save that one for right before the audience questions. I want to pivot for a second and have you both talk about. I know, for example, a year or two ago, it was sometime before the pandemic, which has affected my temporal sense. The NACDL was a part of a coalition of a lot of organizations that were pushing back hard against a law in New York. Were successful as a walking while trans law, a term and expression used often to describe precisely what trans people are often arrested for: walking down the street and minding their business. And I want to hear what you both have to say about status offenses, about the criminalization of transgender people, and maybe tie in your thoughts about what is needed now in the movement to end those, and what is needed now in the movement to end these HIV and infectious disease criminal laws, whether on a federal or a state level. Activists, I want to hear all your prescriptions for both of these, but I do want to spend a little bit of time hearing about status offenses and the criminalization of transgender status in our country.
I think generally policing strategies just in general tend to profile and target, trans women, trans women of color in particular. And, we know that that's resulted in the criminalization of lots of trans folks. And so, I think about 21% of trans women have spent at some point in their life some in either prison or jail, compared to 5% of other like adults. And so, we know that like HIV, criminalization, these laws are driven by stigma, this notion of othering that exists, and not really based on anything that is actually substantive. And so, I think that what we have to do, like I think that we're doing in the HIV movement space, is building a bigger tent bringing more people in, talking about how all these issues overlap each other, and finding ways that we can, create some synergies around really advancing the work, more broadly, really getting out of our silos, talking about these issues as the part of systems as opposed to any sort of behavior. Catherine said it before, like, people are going to continue to have sex, all kinds of sex, different kinds of sex, but it's not about that. It's about these systems that have been created that end up, really harming, folks who are in the margins.
And I think, there's lots of data on this, but also just from the experience of the folks that we work with. The people, trans men and women, are arrested simply for trying to use, or thrown out of restaurants, or arrested for simply trying to use the bathroom for the gender marker for which they identify. Trans women are routinely picked up on for solicitation or suspicion of solicitation simply for walking down the street. You would want somebody who's sexually active to have a lot of condoms on them, and yet when a trans woman has a lot of condoms in her bag, that's been used in a number of jurisdictions, not in New York anymore, thank God, but as evidence of an intent to solicit. And anecdotally, because we don't have a deep dive on the data yet and we never really had it, in Colorado, just speaking with the public defender who had represented sex workers who were arrested there, she looked back, in her experience, the majority were trans women. The people that were arrested and prosecuted for basically suspicion of solicitation while HIV positive were trans women of color. And what often happens, and this is also a big issue when you're talking about felony laws, people are kind of pressured to plead. So these cases get pled out. It's very difficult to track how many of these happen, because for that reason as well.
And Catherine,
yes,
maybe you could share with the audience, and then Eric as well. Hopefully, the discussion that we've had until now, and I know my colleague Stephen Logan is going to be sending me questions in an email from the audience, questions from the audience in an email shortly. But one of the things that would be really helpful, because I do hope that just this 45 minutes hearing about this, which frankly, every time I describe these laws to people, and every time I describe the indignities that people have to suffer, whether it's infectious disease laws or status laws, or just generally the way in which so many marginalized people are treated by the police, it's infuriating, and it's just, how can this be happening? And so I ask you both, what can you tell the audience they can do? The people who are watching this webinar, how can they help with the work of your organizations, with the work of the coalitions that you all have built to try and get rid of these laws and to try and address these injustices?
Yeah, well, you did ask us for solutions, and your last question, how patient of you to act as if you hadn't, this was the second time you had to ask. Several things. It is hugely helpful in tracking and responding and getting representation for people who are charged to have a defense attorney in every state where these laws happen. And we're trying to put together, we do have an HIV legal collaborative, and some of the attorneys who are part of that agreed to advise us, help us identify a lawyer. Some of them are willing to take cases. Some of them take them on a sliding scale or pro bono or for a fee, but it's really extremely helpful if you're interested in being a resource or taking cases. If you reach out to the Center for HIV Law and Policy, and I assume that there's contact information associated with this webinar, that is hugely helpful. There are community coalitions in a number of states that are organizing. Mississippi is at an early stage. Tennessee is at a relatively early stage. There are things going on in Ohio. Eric can talk to you about Georgia. And I know he's trying to line up some attorneys in the South as well. I mean, those are a couple of things. Eric, you want to speak to that?
Yeah, ditto to all those things, Catherine. I think, the other piece of this is, well, I don't think that it goes far enough, the Repeal Act, Barbara Lee's bill around HIV criminal reform, but providing new federal guidelines that promote national HIV criminalization reform, I think would be a good step in the right direction. And a part of those guidelines should really be around encouraging states to authorize proportionate sentencing for HIV exposure crimes, that the prosecution should really have the burden of approving actual transmission, and that the HIV positive defendant, that the burden approving non-disclosure and consent should also lie with the prosecution. I think should be another part of whatever the new federal guidelines would look like. And then the last part, which really is around the science, that states have clear guidance and direction around conduct that is an actual mode of HIV transmission. And so I think just sort of, on the federal sort of, advocacy in that space, that may be another way for folks to also be plugged into the work. Ivan mentioned at the top, I'm also doing a Soros Fellowship right now, where I am hopefully going to plug in some of the attorneys that I've recruited into the work with CHLP, but really looking for Black lawyers who are interested in being a part of HIV movement work. We know that the folks who are really impacted by these laws are Black and brown folks, and being able to have someone who is able to put a racial justice lens on that work, I think is super important. And so, we're looking to build this network as well, and hopefully be in lockstep with the work that CHLP is also doing.
Excellent.
I think, I would just differ, part company with Eric a little bit on that. I think the repeal, if it doesn't have incentives, financial, there has to be a carrot and a stick. And because I don't think states are going to care about guidelines unless there is some reason that they have to. So, if the CDC hinged its funding of certain programs on a state's certification that their laws do not disadvantage people on the basis of health or disability, that would take care of it. If some of the massive federal law enforcement programs also had similar kind of conditions on funding, that where states had to certify that they did not have policies or procedures that disadvantage people on the basis of health status or disability, that could be pretty helpful. And I think we always need more people who are engaged or trained in public health, engaged in this work. Prosecutors and courts, are far more persuaded when they about revisiting this issue when they hear from either other prosecutors or when they hear from people who are medical and public health professionals. That has a huge, huge impact. And you know, I think, and also, I mean, back to the trans issue, I think we're setting up part of the work that we're doing through the Positive Justice Project Partners Group is bringing sex workers and prosecutors to the same table where there can be an exchange where there, you know, women who are being targeted can actually talk about what this experience is like and what kind of solutions they think are going to make a difference.
What you were talking about a second ago segues into this question from Stephanie Collins. Do you know of any cases in which a person, and what I'm referring to is when you were talking about public health testimony, maybe that will be a part of this answer, maybe you won't, I don't know the answer, but you probably do, both of you. Do you know of any cases in which a person charged with an offense of exposure to HIV, or in which that was the basis of the charge, was acquitted at trial?
Yes.
Okay, I assume if you had more details.
Yeah, I mean, but it depends on, I mean, and I think in a way the Nick Rhodes case in Iowa is interesting. And the acquittal there, he originally took a plea. He was urged to take a plea, and his conviction was vacated because, interestingly enough, based on ineffective assistance of counsel, because the nature of the plea essentially was not, you know, the Iowa statute required exposure in a manner that could transmit, intending to engage in behavior in a manner that could transmit the virus. And in fact, since he had used a condom and had protected sex and also had an undetectable viral load, his pleading to having engaged in such conduct did not match the factual legal requirements of that statute. And yes, there have been some. I mean, we don't. We often get contacted about the horror cases, but yes, and usually that happens when the person has early contact with some advice. They don't talk to prosecutors or investigators. Mm-hmm. They have a decent expert witness and an attorney who is willing and able to try the case rather than just have it plead out.
Okay, great, thank you. First, we've got about 5 minutes left, and I'm going to defer to Eric and to Catherine to have the last words and to close out with anything that they wish to cover that we haven't covered thus far. But it would be remiss of me, or I would be remiss. I would be ungrateful not to point.
Very naughty if you did.
I would be very naughty. No, I'd be very. It would be unacceptable for me to not thank my colleagues who, every time someone is asking a question or you all are invoking a case or invoking some work with CHLP or George and Quality, it's getting popped up in there in the chat with links and all kinds of information, as well as all the materials that are on NACDL's website from CHLP and elsewhere with respect to these issues. So I want to thank my colleagues for enriching this at every turn. And I want to turn to you both, Eric and Catherine, to take the last few minutes and to please share with us, and also to accept my gratitude personally and professionally for what you both do every day. It is so, so important, and thank you.
Go ahead, Eric.
Well, I mean, thank you again for having me. You know, I've definitely enjoyed having this conversation. You know, I think my parting words, you know, just really are about the fact that, you know, advocating for these laws really isn't that different from advocating for, you know, other criminal justice reform issues. That, you know, this needs to be a part of all of our conversations that we're having about, you know, what's needed for us to reform the criminal legal system. These are the same folks, you know, and, you know, I think that if we're able to really build a more expansive tent, that will really be able to get things done. Georgia, we are, hopefully going to get a good bill through next legislative session to reform our law here. And hopefully that will be sort of, a step in the right direction in terms of other states in the South being able to follow suit. And so, again, if you have any opportunity to just learn more about these issues, please check out all the information. And if you want to get involved in any way, I think my information is also dropped there. So please feel free to reach out.
I think lots of folks think that these are a lot of are one-off cases, or they're relatively infrequent. And what we have found is that there are thousands. We know of thousands of cases just in the handful of states that the Williams Institute has done a deep dive on. It takes a while to get this information because it isn't available through regular. It's just the way state prosecutions and convictions are reported. So and I think, as urgent as the need is for criminal justice, massive criminal justice reform, I think one of the reasons we do this work is because I think, as Eric was suggesting, it involves sexual autonomy and liberty. It involves the right to be treated with dignity. It's an assault on the health, identity, and sexuality of Americans in a way that is really just completely, as Ivan would say, unacceptable. And I just hope that folks will feel free to get in touch if they want to get engaged in some way, or offers, inform us on things that are happening that we may not know about, or cases that we may not have heard about. That would really be wonderful.
Thank you both so much. Thank you.